But welcome everyone to the July edition of this monthly Snakebite Hub meeting. We have a couple of items for discussion today. The first would just be to follow up on the same discussion we've been having for the last few meetings, which is that standardized data collection form. So we have a sort of finished, well, nearly finished product ready, which I will walk through with you today, and then I'll pass the mic over to my colleague Kwaku, who will explain his idea for actually deploying the survey for people to test out, and we'll kind of talk about if folks are able to volunteer to test out the data collection form in their settings for both prospective and retrospective patients. We'll get to that for testing it out, and then the second to that is I'll pass over to my colleague Brent Thomas, who you may know from the African Snakebite Alliance, and he will quickly mention the latest call for proposals from them. So without further ado, let me go ahead and share my screen so you can see what the latest and greatest looks like. I see the AI note takers are introducing themselves in the chat. So you guys can see what the latest and greatest looks like in terms of the data collection form. Okay. Hopefully you're seeing my screen here. So there's this Excel sheet that you're seeing on the screen here kind of contains the full data collection sheet that we had been preparing together over the last few meetings. And we've sort of marked ones that are included in that minimum data set that we voted on versus those are included in the full data set. So over here, it might be kind of small on your screen, but the tab you're looking at now is called Data Dictionary. So this actually explains what the different fields are in the data set over here, what section they belong to. So if you remember, we had 5 sections in the data collection form in total. I sort of just added colors for ease of reading. These are the field codes. So these are meant to actually stay as is, no matter where this data collection sheet is being used. This is so that if you ever want to collaborate with another institution that is also using this, it just makes it a lot easier for actually aggregating or joining up that data is if the fields stay fixed. So these don't change. But what does actually change is the descriptions of these, because we understand that this, it's not just English, there's lots of other languages across institutions that are seeing snakebite patients. So this type column here just explains what type of variable it is. So for example, things like patient ID and patient age are numeric. However, things like patient sex are categorical. You'll also see some free text variables. So country of origin, for example, is classified as free text, meaning that there won't be predefined categories to choose from. It's just to fill in the patient's country as text. And then if you remember from when we were discussing, there are some date time variables. So these are variables that are written either as dates or times. And there's some image as well, because there's some variables that require documenting kind of the wound, photo, site of bite, things like that, or pictures of the snake. And that's all part of the sort of larger data collection sheet. The image variables aren't included in this minimum data set that we had voted on. So columns D and E, you may be wondering what the difference is between a question and a definition. So the definition explains kind of what this field means, whereas the question provides the same information, but just words it as if you were going to ask a patient. So if you're prospectively collecting snakebite patient data, it may be more useful for you to have a question in front of you rather than the definition. So for example, for age, the definition of this variable is patient age in years and patient age in months, which is documented here in column E. However, you may wish to ask folks, if you're prospectively collecting data, you'd ask them, how old are you? Or how old is your child? So the question basically takes the definition and rewords it as something you would prospectively ask a patient. So one might be easier for prospective data collection, whereas this one, the definition might be easier if you're documenting retrospective patient data. But we figured we'd provide both for ease of use. And then finally, the last column here is the answer format. So there are some categorical variables, for example, sex. We encourage folks to document, rather than documenting words like male and female, given that these are different in different languages, we encourage folks to actually document numbers. So if you have a patient who is male, you document 1, female, you'd put in the number 2, or 3 for other / prefer not to say. Similarly, for other categorical variables, we've kind of provided formats that would be best to use to document. And this is, again, just in case you wish to combine your data with another institute that's using this this format. This would be easier, but I mean, if you don't intend to kind of use this data collection form beyond your own institution, then that's totally up to you. Similarly, for date time variables, we've recommended a format to document as day / month / 4-digit year. So these are just recommended formats for actually documenting the data. And aside from the data dictionary tab, there's a data full tab, which includes headings for all variables, whereas the minimum tab includes headings for just the ones we voted on. Before I go to the translations tab, I want to mention that you may wish to collect, even your institution might not be able to collect even the minimum data set. That is not to worry. When I pass it over to Kwaku, he'll kind of explain how when this is deployed, you can actually choose. So there'll be an option to choose the full data set, the minimum data set, or kind of your own bespoke data set based on what your institution can collect. And then finally, there's this translations tab, which I will, this week has gone by quite fast, so I haven't had a chance to fill this in, but I will essentially, those 3 columns for question, definition, and format. So from this data dictionary tab, it represents these 3 columns. So I mentioned that the field itself never changes. So these variable names stay as is, but what does change in different languages is these. So this translations tab will include the question, definition, and format in English. I will ask AI to translate it into French, Spanish, and Portuguese. I will need French, Spanish, and Portuguese speakers to verify. So if there are folks on this call that would like to volunteer to verify, that would be fantastic. And if there's other languages that you would like to deploy this in, I'm very happy to also ask AI to translate into those, and then you can verify the translations. So that's kind of an overview of what it looks like right now. And the idea is that we have an Excel version, but also there's an option to have a Word version. So hopefully you're seeing a Word document on my screen now. So this is very similar to the Excel sheet. Again, it's divided into 5 sections, but it's structured more for prospective data collection. So we imagine folks that are prospectively documenting Snakebite data, it might be easier to use a paper-based form or something more like a Word document rather than documenting directly into an Excel sheet. So we've included all the same variables here, except you'll notice that we've included just the questions. So all of these match up to the questions from the Excel sheet. Again, because we've made an assumption that folks that are using the paper-based form will be more likely to be prospectively collecting data. So asking a question would be sort of more intuitive. But similarly, it's structured in the same order as the Excel sheet, so it's easy to document into Excel after, if that's what you're thinking about. And we've sort of marked questions that are part of the minimum data set rather than being included in the full data set. But this being said, Kwaku had a brilliant idea for deployment to say, what if folks can actually choose what data elements they want to include in their form, and then they can choose whether they want to document it in Excel or Word. Maybe I'll pass it over to Kwaku now to explain his idea.
Hi, Ashima.
Hello.
Yes. Okay. So that quickly confirms that I can be heard.
Yes.
So yeah, I have a bit of cough, so please forgive me. Could I cough? So I would want to quickly show you something. Um, show you something as the basis for subsequent discussion. So I have opened an interface on the ISARC bridge. ISARC does a lot of work on respiratory diseases. So if you come to their bridge, they have the instruments over here. So for instance, I'm going to unselect all of them. We should get rid of everything. So if I come to their site and I'm interested in the presentation, I just click presentation and it would populate this with the CRF, a CRF which I can just name and generate a file for. Under the presentation, there is the inclusion criteria. So if I want an inclusion criteria, I can select it as well. But these are subsections. Some of them have sections. If I'm not interested in any part, I can just remove it and it will also remove it from this part. So that's about the whole idea. So I discussed with Ashna that for our or for the PRF that is being developed, in order to make it scale, it will be uh, interesting if we could have platform like this where we have the fields over there. You can just navigate to that site and select the fields that may be relevant to what you are doing. So, for instance, if you are doing a retrospective studies, you may not be able to collect some information. The same as if you are doing a prospective study, some information may not be relevant at that point, just as an example. So, if we have such a tool, it means when it's hosted on, say, the TGHN website, people could navigate to the site, select the instruments they need, click generate, and it will generate um, the instrument for them. Now, what this helps is it helps to make the data more interoperable. You select the language that you are also interested in. So even if something changes, you don't have to go back to the form to make a lot to make changes to the Word document. At the end of the day, two sites would have different word layouts for the scene because they have to make some modifications to the form. We can also add a red cap, like generate for red cap, so that if their intention is to use red cap, just go ahead, generate the XML and import it into red cap. I'm also thinking we can even support some data collection on the platform. Once it is generated over there, you just click collect data, and based on the instruments that you have selected, it will generate a dynamic form, excuse me, which you will use to enter your data. There are two ways to go by it. One is we have it as a service hosted on the PGH, PGHN website. You can just go and uh, work with it over there. The alternative is if we cannot get it hosted on the TGN website or anywhere online, we would opt for GitHub so that people can go and download an executable file which they can run on their local computers. It generates the forms and allow them to also collect data for themselves. So that is the discussion I had with Ashton. I'll be grateful for feedback from what I have mentioned so far. Thank you.
Thank you, thank you. Yeah, so this sounds like a really interesting way to have the data collection form for use. And as Kwaku said, we can think about supporting not just Excel and Word formats for documenting, but then if folks are using things like REDCap, Kobo Toolbox, we can think about integrating those as well so that you get the case report form that works best for your institution. If there's any ideas or feedback, feel free to jump in and we can discuss. Ooh, I see Eric has unmuted. Oh, it was just an accident. If there are no points of discussion here, as perhaps folks are on board with this idea, then we can go ahead and start putting it together. But what we will need, and we will reach out for folks, is for people who are seeing snakebite patients to test this out in their institution. So, oh, thank you, Jackie. Reviewing the Spanish translation would be very helpful. Yeah, I was just going to say we need some volunteers to help verify some translations with it as well. So if anyone is willing to verify the French or Portuguese translation, do let me know. That would be very helpful. Um, and then once the tool is ready, we can recruit people to test it out. I think it would be important to test out in a couple of different settings and as well for prospective and retrospective data collection to see kind of what works well and what doesn't. But we can, I guess, reach out at a future time once it's ready for that. Oh, Julian, thank you. I'll note this down so I can reach out to you guys with the translations. Perfect. Is there anything else folks wanted to discuss related to the data collection template? I will mention that, although this is something that we are creating together and testing out, it is by no means mandated for use. We're more just doing this out of interest and noting that people were quite interested in sort of cross-institutional collaboration. So sort of data collection standards make it quite easy for that. So it's not mandatory to use if you already have a system that's working well for you, but this is just an additional option to use in your institution, especially if you don't already have something set up or something that's working well. And oh yeah, thank you, Jackie. That would be fantastic. Well, and yeah, Zambia would also be great to collect. Thank you, Kingsford. Go ahead, Beth.
Yeah, just to add that if people are collecting data with other questionnaires that could be shared with us, it would actually be really useful to be able to compare across and make sure we're not missing anything.
Oh yeah, good point. Good point, good point. Yeah, we can verify if there's something kind of big that's being collected. We can make sure to add it on our end. Okay, fantastic. And thank you, Kwaku, for that idea. I think that sounds like a fantastic idea. We can perhaps pass it over to Brent now then. And if folks have any other ideas or last minute comments about the data collection template, we can just put it in the chat. Yeah, and I will sum up the request in a follow-up email so that everybody's aware. Okay, passing over to you, Brent. Thank you.
Perfect, thanks. And yeah, it was great to see all of that update. That update on how all of that is coming on.
Mm-hmm.
I'm just going to share my screen, and then let me get the presentation up first. Sorry, as usual, Teams, a bit of technical difficulties on my end. Can everyone see my screen now?
Yes, we can see.
Perfect. So first off, everything I'm just going to run through here is a very quick overview of what the new grant call is. It's all laid out on our website as well as on our LinkedIn. And then it's going to, ARNTD should have some information up on their website as well. But it all links to the call documentation, which provides far more detail than I'll be presenting here. But this is just an overview for everyone. So this is the second open call that the African Snakebite Alliance has put out. The first one went live in January of this year, and we're now getting the recipients of that first round are starting to get their work moving. Basically, I think the first start date is end of this week, actually, or sorry, end of next week. We are seeing new research taking off from this, the first call, which is really good. But the second call, focusing on strengthening community responses to snakebite, it went live last Friday and will be live until September 7th, closes just before midnight. And then we are expecting to review all of the applications and announce the awards in early November, if possible, a little bit earlier than that as well. But it will depend on how many applications we get. So we have two main grants with grant types within this. The first being our network research proposals. So these are to a maximum of £100,000, and these are designed for more established researchers who will be forming sort of a multi-country research proposal across Africa. Our second set are our postdoc or ECR research proposals for a maximum of £50,000. And these are, as from the name, designed for postdocs or individuals who are close to completing their PhDs as sort of a first grant they might be receiving. And they can focus on a single country, but with the hope of having collaborators from possibly one or two additional countries as well. And yeah, sorry, as mentioned, there are two of each of those. So we are aiming to support 4 grants within this call. We are, just to cover sort of the main proposal activities, we are seeking proposals with innovative approaches following a high quality research methodology with clear outcome measures, and we are hoping that applicants will be able to clearly state the potential of future translation and wide-scale adoption of the work in these proposals. The network proposals themselves are expected to demonstrate clear equitability, clear equitable contributions between all members of the team. We don't want to have effectively all the money going to just one country and one group and then having partners across Africa, but it's all being done by one group. It's really designed to build that networking and self-serve collaboration. As mentioned, this call is focused on strengthening community responses to snakebite. So we have key activities that are eligible within the call. So these would include factors influencing human-snake interaction, the effect of preventive measures on snakebite to reduce the actual number of bites that we are receiving, looking at the impact of awareness campaigns, peer-to-peer education, and survival stories, and how these can impact preventive measures or reduce snakebite. looking at interventions to improve health-seeking behaviors and/or access to care, as well as interventions targeted at rehabilitation and reintegration into communities after snakebite. We do have a few key requirements within the call. The first be that proposals must run in at least one African country. Collaborators can, especially within the ECR or postdoc awards, be from outside of Africa, but the expectation is that no funds would be going to those partners, as the money is designed to go to the African partners in this. The applications must align with priorities included in the WHO NTD roadmap. They must demonstrate innovation in methodology or disciplinary approaches. They must utilize multidisciplinary approaches, engage strongly with communities when and where appropriate, lead to implementable solutions that are practical, and clearly state the potential for future translation and wide-scale adoption, as I've previously mentioned. And one of the big things is really strengthening research capacity in endemic countries, as that is one of the main goals within the ASA. So, as I mentioned, this is already live. If you are interested in this, please go check out our website. It is just African Snakebite Alliance. Or on our LinkedIn page, again, African Snakebite Alliance. And on there, you will find the call documents in both English and French. And then on those documents, you'll find links to the specific research checklists for both applications, application forms themselves, as well as the budget template. And then just to highlight that ARNTD are helping us pull together and review and evaluate all of the proposals before they go to the final selection stage. Yeah, so that's all I have. I will share these slides. But yeah, as I said, everything is up on our website. So if anyone has any questions, I'm happy to answer them as best as I can.
Awesome. Thank you. I see there's a couple of questions in the chat.
Yeah, I've just seen them. I didn't see them as they were coming in because all my screens were on. So yes, there can be collaborators outside of Africa, but the expectation is that they wouldn't be receiving any funding. Because again, the main focus of this call is to keep the money within Africa. Second call, is it possible on the network calls for one institution to partner with different institutions on different themes? Yes, completely. So the main themes and areas we're covering, we wouldn't just expect one area to be focused on within an application. You can cover multiple areas and themes within it. And one institution that's specialized in one area can focus on that, while another partner could be focusing on a different aspect of the application. And yeah, I also agree. The One Health approach, we haven't included that wording in there, but yes, it does sort of factor that in. And if the application is taking more of a One Health approach, wouldn't remove it from eligibility at all. Several of the key alliance members are One Health experts, such as our partner in Rwanda is based at the One Health Center there at UGHE there. So is something we regularly talk about within the alliance. So, yeah. Is any other questions? No. So I would just add, which I didn't put in here, but I'll put it into the slides before I share. But though it's awarded through the Alliance and ARNTD is helping with the evaluation and review, the contract will come down from the Liverpool School of Tropical Medicine, as we are the prime with the Alliance. So the actual agreement for the successful candidates will be with LSTM, but it is all linked for the Alliance. It's just as we're the prime from Wellcome Trust on this grant. So, yeah. Yeah, if you have any questions also as we approach the deadline, please feel free to reach out to me or ARNTD, as they have. They're handling most of the Q&As for this call. Thanks.